So heart failure is prevalent in African Americans for a multitude of reasons. I like to divide risk factors into modifiable, things that I can change or things that I can control, and non-modifiable, or things that I cannot control. I can't control my age, I can't control my sex, but I can control my hypertension, I can control the foods that I eat.
A healthy diet is something that we all struggle to achieve and we're all working towards, but there are a few things we can do to really make sure we're eating in a heart-healthy way, and that includes less salt, fewer trans fats, fewer saturated fats, less cholesterol, and trying to increase the amount of fruits and vegetables and grains in our diet. In a lot of our communities, they're either not easy to access or they're too expensive. And they're not as easy as those foods you can get down the block at the fast food restaurant. It's important to go out of your way and take that extra step to include these foods in the diet so you can have a balanced and a healthy diet.
A lot of our high blood pressure has to do with salt intake. And so anything out of a can or out of a bag, any fast food, deli food, those are all things that can affect your blood pressure by 10 to 20 points. Having a daily salt intake of 2 grams or less is really the highlight or the focus of most heart-healthy diets.
Smoking damages a host of things throughout your body. It's one of the few things that we can stop doing that can really improve our health.
Quitting smoking is probably one of the most difficult and challenging things to do. Usually it's a 2-part system between counseling, medications, and nicotine patches. One of those 2 things would be better than doing one in isolation.
Regular exercise is incredibly important. Currently, we recommend that people do either 150 minutes of moderate activity or 75 minutes of vigorous activity a week. And that's all that it takes.
So daily weights are very, very important. We all hate to do it, but first thing in the morning, weighing yourself before you eat anything, that is what we call in medicine your dry weight. The first thing you'll see as your body starts to hold on to fluid is that weight will go up. So if we can make an intervention when you're starting to gain a little bit of weight or your ankles are starting to swell and we can adjust your medications, we can actually prevent it from progressing to the point where you're short of breath at rest and needing to go to the emergency room.
When it comes to maintaining your cardiovascular health, it can be overwhelming to think about all the different numbers and all the different tests that you need to keep track of. One of the best things you can do, meet with your healthcare provider and tell them that you're concerned about your cardiovascular health and to make a plan.